Hi, I'm Dr. Ute. I'm an accredited counseling psychologist. I am a chartered counseling and coaching psychologist and a fellow of the higher education. Just Ask is a podcast where people come online here with me and simply ask questions they always wanted to ask a psychologist. Enjoy the episodes, and if you are interested, just ask and come on.
Hello, my name is Jackie Power and I'm a poet and I'm also a specialist in addiction. And I have performed at the Edinburgh Fringe Festival. I have my own podcast called The Therapeutic Poet, but I love helping those that are affected by addiction and especially their loved ones. I think that this ends up being a hidden community of people that are struggling alongside those that are struggling with addiction.
Hi everyone, welcome to Just Ask. And Jackie, welcome.
Thank you, I'm delighted to be here.
What an honour. I'm not even waiting, just ask your question.
Okay, I don't have a question. I have a poem that I've written that I then want us to discuss and want your perspective on, if that's okay.
How very beautiful. What a present for us, guys. So shall I say just poem?
Yeah, just poem. Here we go. Just wait until you meet hopelessness. No, I promise it's not a threat. You just don't know her beauty because you haven't met her yet. Yes, I know that she's your acquaintance, but you always run away. Instead, I'd invite you to see what happens when you stay. You think she'd drag you down and anchor you to the floor, that you'd never rise again, a thought I know that you abhor. But look closer at her face now. See what messages she brings. Beneath her fear you try to flee, she carries a pair of wings. For when you get to know her, really look her in the eye, she'll be showing you what to let go of, to really allow yourself to fly. Those things that you're so sure of, that you think will always stay the same, she'll show you that through surrender, you can learn to use your pain. Discuss.
Wow. Wow. I get quiet when my mind explodes with talking. What an incredibly powerful reframing of a word, a concept that people bring to therapy as their brokenness, right?
Mm-hmm.
The idea when people say it's hopeless is, on the one side, it rings alarm bells left, right and center, immediately brings safeguarding in. And on the other hand, it has this, it seems to be a synonym for the in-depth of suffering, the deeper suffering people can actually encounter. And then you come, you take it, and you do something magical. You are reframing it as a door to healing.
I really think it can be. I think that's the scary thing, because often I think people use their defences or use their coping strategies to not feel the depth of that hopelessness. But I think when we feel the depth of that hopelessness, it's an opportunity to get curious. I'd love your views on being curious within the therapeutic relationship.
I say to people, if they want to work with me, and I do say it like that, it's three things. You bring, or you need to be willing to bring. It's courage, kindness, and curiosity. And I think curiosity has this very, it has this nicey thingy, we are curious. It brings us back to the child that takes things apart without fear. But what you are saying is, of course, curiosity needs the courage to look at, right?
Yeah.
Because it's not the Rubik Cube we're taking apart,
No.
or the, I don't know, £5 million now super expensive Lego set, right?
Yes.
Which, oh, there's a tiny little thing. Oh, I might have just swallowed. No, it's we are taking something apart which we don't want to take apart. We don't want to look at, right? That's what you
absolutely.
said. I want to run away. It shows another level of meaning, not purely for hopelessness, but also for curiosity, doesn't it?
And I think, especially nowadays, when there's so much going on around us, that we're bombarded with reasons why we need to be hopeless. And I think it brings us back to that appreciation of the glimmers in life. Like Deb Dane talked about, looking for the glimmers.
Yeah.
And I think that then builds into building our resilience and our resources, which I think are two cornerstone things for mental health, actually.
When I left the house this morning, there was, I listened to the radio, and there was the sentence, it has never been so hopeless for the future generation as it is today. And look, I'm not putting, happiness source over a time that, excuse my language, is quite shitty, right? In many aspects. I also think it is deeply ignorant and at times even arrogant towards the generations that gave birth to children in war, or now give birth to children in war zones, as if there is a misunderstanding of how deeply people suffered before. And yes, of course, people say, yeah, but now it's the whole world. But I would argue, during Black Death, right, during the time of the pestilence, all you knew was your village. So that was your world also.
Yeah.
So is the idiocratic suffering, has it really changed? Or has it, well, geopolitically it has changed. Is it really different for the person in and of themselves? And if we want change in the world, it must start with us.
Yeah, absolutely. Because the micro reflects the macro, right? Yeah. And that's what I do to bring myself back to, moments of hope is to remember exactly what you've said, that what is within my actual immediate frame of reference, frame of influence.
Yeah.
And what can I do with that? When you have someone that comes into you and says, I feel utterly hopeless, where do you begin with them?
Yeah. I love the body language.
Right, leap in.
Because we leaping in.
What do you mean I'm a rescuer?
Yeah, we want to fix. Allow me to do a little detour there. I've asked the students, I said, why are you sitting in my class? So I lecture on clinical and counselling psychology on a bachelor at University of London, Birkbeck. And at the end of the day, what they said, we want to help. We want to help a person. And this does not sound super sexy, or these aren't big words. But I think it's probably true for many people who go into our profession. We want to help. Which of course means when you are so put in contact, and it's quite visceral, guys, you need to understand that when you sit with somebody in the room, it's not just an intellectual connection, it's an emotional, it's a visceral connection also. And I think even today, my first impulse is, I got to fix. Because that's what I want to do, right? I want you to leave the room, to leave therapy feeling better.
Mm.
And that's the worst we can do in that
Yeah.
moment. Because what this totally ignores, and allow me to use the superlative, I don't know, is totally a superlative? English teacher, just write to me. But what we are ignoring with that is listening to the pain and acknowledging the suffering.
Mm. Yes, which needs a witness, right?
It's holding a space which nobody wants to hold.
Yeah.
Because if somebody comes with, there is no hope. Hope is not a thing that is only residing in the person. Hope is us, right?
Mm.
And it comes into the room and engulfs everyone in there. So it's not purely the patients, the clients, the other humans, non-hope, but it triggers my ability of non-hoping too. And I think you need to really train, you need to have a lot of insight work, you need to know yourself very well in order to acknowledge your own impulse. Yeah, the reaction we want to fix, rescue, you said, right?
Because then we're making it about us.
Absolutely.
And what dynamic is that like for the other person? I'm sure they've been in relationships like that where when they try to acknowledge their reality and say what it's like for them, it becomes about another person.
Yeah.
And we're trying to be that container where it can just be, right?
Yeah. A very good friend of mine said to me the other day, people are really shit listeners. I love him for that, really. A shout out to Den. I love him for that because people are.
Yeah.
And our job is to be good listeners and to hold the pain. Not to hold on, but to hold.
And how that can be different for every person, because part of the listening, I think, is to create a brave enough space where the client can say, that kind of listening doesn't work for me. That's actually, that's just really triggered some other stuff in me. That's where the work can really be, isn't it? Yeah.
Now we have a dialogue.
Yes.
Right? Now we are not any longer of me jumping in because I can fix. Because, gosh, I've studied for so long and I have so many supervised hours and I've got all these modalities and I've got the title and wah, 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 wah.
Yeah.
Now we have a dialogue. And now at the end of the day, we have two experts sitting in the room. You are the expert of your life. I have no idea about the other person's life. Right? And this idea of walking in somebody else's shoes, well, good luck, right? I would say I can approximate, but I never can walk.
Yeah.
And now you are inviting me in, and I can invite you into my expertise. And now we create a piece of work which is around the person.
I've got another poem for that, which I really hope that I can remember.
See?
I really hope I can remember it. But is that okay if I jump in and give it?
Go for it.
When we seek a diagnosis, are we hoping for prognosis in the handing to an expert our true fate? I can't help be suspicious, although the thought's delicious, that a simple label help improve my state. The problem with this theory is it leaves me not to query the godlike status that is given by default. With their degrees and expertise, I should really feel at ease that they'll combat my dis-ease and make it halt. But the problem with this theory is it leaves me not to query the godlike status that is given by default. Oh, I can't remember it now. But it ends with the one that really knows me, that really has the PhD in the specialty of me, is me. Perfectly imperfect, right?
It's absolutely brilliant.
Okay, so I have another question.
Go for it.
I mentioned in that poem the word diagnosis.
Yeah, you did.
Which is something that gets talked about so much. You just have to be on TikTok to, be able to self-diagnose. So I guess my question is, what are the merits of a diagnosis and what are the drawbacks of a diagnosis?
So that depends on the person and it depends on the thing that is diagnosed, right? So if you break your shin bone, I think it's quite helpful to have a diagnosis because then the diagnosis can tell you what we can do. That's not true for all diagnoses. I worked for a long time in chronic pain. And in chronic pain, there is one condition that is called fibromyalgia, which is widespread chronic pain. It's a diagnosis. So everyone who gets the diagnosis of fibro now comes with that underlying thought of, when I have a diagnosis, we know what to do with it, right? Which is unfortunately not true. Because what does chronic pain actually say? What does the word chronic mean? It means it will be with you forever. But we do not know what to do with it. So now you have a diagnosis which may or may not have a function of how other people, when you are in a work environment, have to take care of you. But it's probably not giving you indicators for healing. Because healing, in a sense of getting healthy again, without that thing you don't want, doesn't exist. So I think this idea of diagnosis does something to me that makes me feel better because of the diagnosis. That is something which we are seeing more and more. But I don't see that this is true.
I think it is such a complex area because I think it helps for some people to validate the pain.
Yeah.
It helps to, at times, give access to additional help.
Yeah.
But there has to be questioning, I think, around who is creating the characteristics of the diagnosis. When you look at the DSM and who were the people that decided what should be in there or shouldn't be in there, it's up for a lot of challenge, isn't it? Because it's not like there's medical tests for a lot of the things that are diagnosed within the DSM.
Well, in our world, there isn't anyway. I mean, I think what we need to understand that in psychology, we use the word signs and symptoms interchangeably. So when you go to a GP, you have signs. So, they measure your temperature. You have temperature which is above the temperature it should be. You are sweating, for example. You have, I don't know, maybe diarrhea. So all of these are signs. These are objectively measurable things, right? When we pop them together, we have a symptom, right? So we can say, okay, a high temperature, a inflamed throat. If we have a couple of these signs, if we pop, there is a symptom of having a particular illness. And then when we put the symptoms together, the syndrome comes, and then we can say, okay, it's, for example, COVID.
Yeah.
Right? That doesn't exist in psychology, right? I cannot tell you whether or not you objectively have a depression, because my sign doesn't exist. I only have a symptom, so I have only this, you are telling me that.
Yeah.
Correct?
Yeah.
This means the idea of objectivity does not exist. Yes, we can validate it through observations of others and so on, but of course this does not really happen in big time. I mean, look at ADHD. The amount of diagnoses that are coming out. And there is a huge thing now, are we overdiagnosing ADHD? I think you need to understand how it has to be diagnosed, and that it is a day process, a day clinical work at least, plus so much more questionnaires and reports across the person's network in order to have a good understanding. But you have people who go to somewhere, half an hour questionnaire tick box thingy, and then they have a diagnosis. That's bloody useless.
Yeah.
Right?
And we're not looking at it from a cultural perspective, an environmental perspective. There's all of these other factors that kind of come in. And yes, exactly. It needs much more examination.
So if you want to know how I work with it, for me, I always ask a person, what does the diagnosis mean to you?
Yeah.
That's my can I say standard curiosity stance? Is there such a thing? Because I need to understand. I once worked with a person who had a diagnosis of bipolar. So, it's either you're extremely sad or you're extremely super happy, which is then called manic. And this diagnosis, which was about 15 years old, this person said to me, every time I feel joy, I am scared that I'm manic.
Oh, that's heartbreaking.
It was heartbreaking. And our whole work was around allowing yourself to feel joy, even though you have a diagnosis which will never go away. There are certain diagnoses, if you have them, you're stuck with them forever, right? And this piece of work could only exist because I said, talk to me what this bipolar diagnosis thing means anyway to you.
And I think that's such a key thing when we're practicing. I know for me, like trying to dismantle this idea of power, as a therapist, you can be in a position of power just innately by being in that position. And what you're saying is, when you're asking, what does it mean to you, is you're coming alongside them and saying, show me your worldview.
Yes.
Yeah.
Yes. For some people, it's really important to have a diagnosis. You said validation. That is such a beautiful thing. A chronic pain patient said to me, I know it doesn't help me, it doesn't treat me, but you know what? It's not in my mind. Yeah. And that, again, was incredibly powerful and, beautiful. The idea, and personal rant about TikTok, the idea that a diagnostic word, by definition, heals you, is bollocks.
Yeah.
I say this again. Bollocks. Because you need to understand what is it in service for? What's the function of the diagnosis for you? And let me put one on top, in this moment. Because for this patient, the bipolar person, they said it was really helpful 10 years ago. But when they met me, they were stuck in fear of feeling joy, right?
Yeah. And that's something else as well, isn't it? About how things can change and how our beliefs can change and serve us at different times and have that flexibility. I think people, coming back to that hopelessness idea, people can get very stuck. It's always been this way. And how can we help people defrost from that,
Yeah.
to have a different perspective?
So I work across different modalities, and one modality I work with, it comes from third wave behavioralism, and it's acceptance and commitment therapy. And the idea of ACT is it's not ACT's idea, but they have phrased it into the behavioralistic world. Let me put it like that. Is this idea of psychological flexibility. And psychological flexibility needs to what is helping me in this environment at this time.
Yeah.
So if we are taking it through logically, quite radically, this means whatever we do, whatever we think, whatever we don't do, whatever we feel, needs to be evaluated in the moment. So even though it might have been good for you yesterday, it doesn't mean it's right for you today. And even if it's unhelpful for you today, doesn't mean it's unhelpful for you tomorrow. So the idea of the diagnosis was not helpful 3 years ago, and I'm holding on to that, is actually inflexible.
Yeah.
And the same the other way around, right? I just use this as an example. As a psychologist, as a therapist, as somebody who works with people, we need to have the openness to go to the person and say, talk to me. You tell me, where are you now?
And that requires the psychological and emotional flexibility in us, right?
Yeah.
Because it's having the confidence to be able to say, I will handle it. I am confident enough to be able to contain that.
Yeah.
And be that safe space. I prefer brave space than safe space, because I think sometimes when we think about a safe space, how do I know what's safe for you?
Yeah.
Right?
Yeah.
When it's a brave space, it's like you bring the sense of unsafety, and we'll discuss that.
And the development in, absolutely,
Yeah.
And I think when you look at modalities you can offer to people, so, what type of therapy you can offer, I think within existential and also with third wave behavioralism, the psychologist, the therapist is part and parcel of the journey. It's not this blank slate or white canvas or, the one with the knowledge. We have to show and we have to accept and acknowledge that we are nothing else but humans also.
Yes. Absolutely.
This idea of we are sitting in the same boat is such a, look, this is not rocket science, and yet it's really powerful. And I think in these modalities, it is part and parcel of the quality you need to train in order to work.
Yeah. Can I just share an experience of that quickly, which is when working with a client. I said jokingly about being a compulsive rescuer before, but they presented something and I suggested something as a result of what they said. And they went into their own process around that, which is, not feeling empowered, and they made that about them. And I could actually come in and say, you know what, I'm a human. And sometimes my old coping strategies come in of me trying to, that can still happen where I bring my stuff in. And I need to own that. I need to say that was me, that's not about you. And it was incredibly reparative, because actually that enabled her to trust her own instincts more and to trust that sort of gut, that doesn't feel good. And for us to be able to work on that. Yeah. So it's not about being perfect, is it? It's about being, like you say, being human. Yeah. So we talked about hopelessness and the acceptance of that, but I'd like to bring in hope. I'd like to bring in where and how can we find hope, and is that a different mechanism from accepting hopelessness? I hope you've got an answer.
The reason why I laugh is, and I look, let me just come out. For me, hope is not a strategy. There are a couple of no-go words I really don't like. Hope is one of them. I tell you why. Of how I conceptualize hope. Hope for me means I put it onto the outside source to somehow initiate change. Right? When you are tragically in love and the other person really doesn't want to be with you, you hope the person changes. That's not going to happen, right? You want to be more active because you have a sitting job. You hope motivation is going to set in so you can go for a run. That's not going to happen either, right? So for my conceptualization, hope is something that is put onto the outside world. I'm also, just to be very clear, whilst I'm agnostic today, I'm born Lutheran. So there is this hope was probably very much conceptualized in such a way when I grew up. Where I go with my patients, I'm very transparent about that also, because hopelessness comes in as a theme, of course, right? And as a quality of suffering. So I believe I need to be very transparent of where my own stance is. And it's quite a strong one, right? But I ask patients, clients, the other person in the room, whether we could work on faith.
Yes, I was thinking interconnectedness. Yes.
Could we start fostering faith in your own abilities?
Yeah.
Goodness, potentials, choice, change. Could we bring that into yourself, into your life? Starting to have faith in myself so I can step into the world and do things. And it's, when you find it really difficult to do this phone call, you can hope somebody else does it. You can hope the phone call anxiety goes away. You can hope the thing just goes away in and of itself. Or I'm using it as an or now, so I'm putting, it an either or here. Or we can start saying, can I have faith that I will be able to master it?
I think it brings in sort of those positive psychology elements of strengths and where have I been in a situation before where I have felt like this, and what have I done in order to try and, how did I overcome that? How did I deal with that?
Yeah. It's not about negating the problem, right?
No.
It's actually about acknowledging, holding the space, and also fostering potential. Because, look, for me, my brain thinks in pictures a lot. So if I visualize the humanness, I see us as this gestalt, which has all of these potential seeds sitting all over the place, and depending on where life shines onto us, these seeds are flourishing, right? And
I love that view. Yeah.
And it's not just, the good seeds or the bad seeds. It's just seeds.
Yeah.
So in order for the seeds on that side to come to life needs to shine onto that one. So if you go through something excruciatingly difficult, like abuse, other potentials will come into life, but only if you have a space where there is safety to also develop them, right?
Yes.
But for that, life needs to shine onto different parts of you.
Yes.
And to use these potentials, we need to learn to recognize that we have them and we can use them. And that's what I conceptualize with faith. In us, in our doing, and if you are religious, into that God you believe in helps you with it, rather than I hope somebody's going to fix it. Right?
Yeah, that's beautiful.
Maybe there's another poem in the making.
I have got one called I Hunted for Hope, which again I might not remember all the way through. Will I give it a go?
Of course you will. What a question, yes.
I hunted for hope in the cupboard. I looked for it under the stairs. I searched for hope in the coffee jar. I sought it in strangers' stares. I asked about hope at lost property. I checked my inbox in case. I poked about under the sofa. I even went through the waste, but it was masterly sequestered. Its camouflage had me tricked. I was on the edge of despairing when something inside me clicked. I glimpsed it in the squirrel, who simply cared not a jot about whether my life as I wanted would go as planned or not. I can't remember the rest of the ways that I glimpsed it. But again, it goes on about all of those ways that we find hope through that interconnectedness, through that faith of that squirrel that kept on knowing that it would go and eat the acorns every single day and where to find them, or the planets that made me feel so small. And this lit something inside of me, for none of it matters at all, for we are alive. And that's magic, a once in a lifetime chance. And I caught Hope by the hand again, and I asked her once more to dance. I know you don't like hope, but maybe we'll call it faith instead.
But that's the moment to dance. Thank you. Thank you for coming on. Thank you for sharing not just your incredible brain and mind, your beauty and your words.
Oh, thank you so much for asking me.
Your time. I hope you enjoyed it. I thoroughly did. We are happy to have, of course, your comments. Subscribe. It means the world to us. And see you soon. Thank you, Jackie.
Thank you.
Interesting questions, right? Have a look at the next episode too. And if you want to just ask, write to us and come to the studio. Please subscribe. It means so much to us.